Greetings of peace, everyone. We are the group number 5 of first year DMD-5 from Our Lady of Fatima University, Valenzuela City Campus. Allow us to present to you our community project proposal in NSTP 2 accomplished on July 2025. It focuses on developing a community engagement, public health, and education in a bid to foster a safer and healthier environment. Our attention turns to propose a project that is designed to increase awareness of HIV and enhance sex education to local communities. But before we proceed to the main subject, let me first introduce to you my talented groupmates. First, Ms. Rona May Abug, Ms. Samantha Nicole Barrios, Mr. Rod Benedict Bocchio, Ms. Sandy Eliza de Guzman, Ms. Rafael Luis Martinez, Mr. Aaron Stin Pabilio, Ms. Isi Payongayong, Ms. Suzette Margaret Sanchez, Ms. Mervelyn Sotomango, our assistant leader, and I'm Ayumi Garlin Faith E. Doria, the leader of this group. Thank you for meeting our team. Together, we brought different strengths to this project, and we're excited to share it with you. With that, let's dive into our main subject. Our target barangay is Barangay Commonwealth, Quezon City. Did you know that Quezon City is the largest and most populous city in Metro Manila with 3.2 million residents, covering around 161 square kilometers as of 2024? Within it, Barangay Commonwealth has over 213,000 individuals, making up about 7.2% of the city's population. Despite this, the long-term challenges and problems faced by Q citizens remain unsolved, and the alarming rise in recorded HIV cases is deeply concerning for the entire community. Months January to May 2025, QC recorded 421 new HIV cases, a 2.4% increase from the previous year, and 35% of those affected were young people aged 15 to 24, including 40% who are students. Concurrently, more than 21,000 residents underwent HIV testing during this period, a 16.7% rise from last year. Despite an expanding network of social hygiene clinics, including the innovative Clinica Eastwood, Drive, Park, and Test program, long-term challenges remain unresolved, and the sharp increase in HIV cases continues to worry residents and officials alike. To address these urgent concerns, our project Breaking the Stigma HIV Prevention through Sex Education for Rural Community proposes a peer-led education-focused initiative in Commonwealth that aims to empower youth through comprehensive sex education, encourage regular testing, and dismantle stigma through community engagement, working in partnership with barangay leaders, local health facilities, and youth organizations.
Background and Rationale. From 2010 to 2022, the Philippines had the fastest growing HIV epidemic in the Western Pacific, with a 418% increase in new infections and a 535% rise in AIDS-related deaths. As of March 2024, 55 people are diagnosed daily, out of about 122,000 individuals living with HIV. Only 64% receive antiretroviral therapy, meaning many are left untreated and vulnerable. A review by the University of the Philippines shows that teachers are still hesitant to teach sex education due to cultural and religious reasons. This results in limited access to comprehensive sexuality education. A study by Baron 2025 reveals that only 36% of MSM could correctly answer basic HIV questions, And many young people believe in myths like the withdrawal method, preventing HIV. Formal education is inconsistent, so many teens depend on peers or social media, which often spread misinformation. Barangay Commonwealth in Quezon City is highly populated with many young residents. However, cultural norms and stigma prevent open discussions about sex and HIV. There's a lack of safe spaces where youth can ask questions or learn about their health without being judged, leaving them unprepared and uninformed. According to GMA Integrated News 2025, Quezon City has a record of 421 HIV cases from January to May 2025, 2.43% higher compared to the same period last year. Quezon City continues to record high cases of HIV, especially among adolescents and young adults. Many in this age group, including LGBTQ+ individuals, lack the right information about how HIV is transmitted, how to prevent it, and where to get tested. Misinformation, stigma, and fear often lead to silence, which only increases the risk of unsafe behavior. To respond to this growing problem, a program called Breaking the Stigma, HIV Prevention Through Sex Education for Rural Youth, has been proposed. It aims to provide accurate and age-appropriate information about HIV through seminars and post activities. The project hopes to empower youth to protect themselves, encourage testing, and promote open conversation. Education is key to fight stigma and reducing HIV cases.
One of our main goals is to raise awareness about how HIV is transmitted, it can be prevented, and why safe sex practices are important. We plan to use educational materials, outreach activities, and social media to reach more young people in a way that's clear, respectful, and relatable. Another important part of this project is addressing the stigma and misinformation that still surround HIV and sexual health. A lot of young people are scared to talk about these things, and we want to help change that by encouraging open and informed conversations without judgment. We also recognize how important it is to work with the people who hold influence in the community. By collaborating with barangay officials, health workers, and local leaders, we're hoping to gain their support and make sure the project is welcomed and understood by everyone. Aside from education, we want to help make preventive tools more accessible. That includes things like condoms and HIV testing, which aren't always easy to find or ask for, especially for the youth. This project hopes to change that by making these resources available and approachable. Lastly, we want to make sure that the materials we produce, whether printed or digital, are clear and engaging and tailored to the needs of the community. Whether it's a brochure, a poster, or a short video, our goal is to communicate in a way that connects with people.
The beneficiaries of the project Breaking the Stigma, HIV Prevention Through Sex Education for Rural Community aims to help different groups by giving them the right knowledge and support. Each group has different needs, and this program is made to guide, protect, and empower them. First one is adolescents and young adults. They are more at risk because they don't always get the right information. So these projects help them learn the truth about HIV, safe sex, and how to protect themselves. Second, out-of-school youths. Since they are not in school, they miss sex education. These programs gives them the chance to learn how to avoid HIV and make safer choices. Third, parents and guardians. This help Parents or guardians learn how to talk to their children about HIV and sex in a good and respectful way. The fourth one is barangay health workers and peer educators. This project gives them the new knowledge material so they can teach others clearly and correctly in the community. And lastly, LGBTQAI plus youths. This makes sure they feel safe, accepted, and they get fair, correct, and kind education about HIV prevention.
Our upcoming community outreach program in Barangay Commonwealth, Quezon City will aim to raise awareness about health and will promote inclusion for young people and LGBTQ plus individuals aged 13 to 24. The project will run for 1 month and will be divided into 4 parts: spreading awareness, educating with the community, engaging participants through activities, and culminating with a creative contest. We will use both face-to-face and online methods to ensure that more people will be able to join and participate. In week 1, we will begin by preparing everything we need. We will meet with barangay officials to request their support and we will coordinate with the groups like Fusic Self-Test Express for free HIV test kits. Flyers, posters, and consent forms will be printed and organized for distribution. We will go house to house to distribute the materials while also posting on social media to reach a wider audience. Week 2 will focus on learning. We will conduct a seminar about HIV, AIDS, and sex education with invited guest speakers. After the seminar, there will be an open forum and small group discussions to help participants better understand the topics. We will also offer free medical checkups and HIV testing with proper counseling. An information booth will be set up for participants to ask questions or obtain more resources.
Okay, so for week number 3, we will conduct community engagement activities. This week aims to reinforce learning and keep the momentum going through fun and interactive events. We will start with games and icebreakers to energize everyone, followed by a quiz bee to test and reinforce knowledge about HIV, AIDS, and reproductive health. We will also distribute more educational materials focusing on birth control methods and contraceptive options. Additionally, we want to support students in need by giving out free school supplies. And to promote a healthy lifestyle and HIV awareness, we will host a fun run and community walk where we will also distribute free t-shirts to all of the participants. These activities are designed not only to educate but also to strengthen community bonds and encourage volunteerism. And at the end of the week, we will gather for reflection, bonding activities, and feedback sharing. And lastly, for our week number 4, we will focus on advocacy and creative contests to keep the conversation alive. We will launch a photography contest and slogan or poster making competition, encouraging participants to creatively express messages about breaking the HIV stigma and raising sex education awareness. We will use hashtags like hashtag breaking the HIV stigma and hashtag sex education awareness to boost online engagement. Entries will be posted on social media and the community will be invited to show support through likes and shares. Winners will be selected based on creativity and social media engagement, and they will receive certificate and cash prizes. This final phase wraps up with an awarding ceremony and distribution of prizes, celebrating everyone's efforts and contributions. In the end, these 4 phases ensure that our project is well organized, impactful, and sustainable. And by combining information campaigns, interactive education, community bonding, and creative advocacy, we aim to truly engage, educate, and empower the youth and LGBTQIA+ community. Together, we hope to make a lasting difference in raising awareness and breaking the stigma around HIV and sex education. And that concludes our implementing strategies. Thank you.
So now let's move forward to the project management. Our seminar entitled Breaking the Stigma, HIV Prevention Through Sex Education for Rural Community main goal is to educate the rural communities about HIV, to open their minds through a comprehensive sex education. This seminar aims to break the chain of transmission and help individuals protect themselves, promoting a healthier, safer, and stronger life for all. In that way, we are focusing on prevention rather than just protection. This seminar also aimed to provide essential knowledge and promote HIV awareness, empowering the youth to break the stigma, end discrimination, and give hope to those affected.
This project will utilize a comprehensive approach to sex education that incorporates accurate information about human immunodeficiency virus, also what we call HIV, through conducting an informative seminar. This seminar will feature two guest speakers, one focusing on HIV awareness and the other on sex education awareness. The seminar will be held at the Quezon City District 2 Gymnasium located in MRB Compound, Pilot Drive near Barangay Commonwealth. It is a spacious venue that can accommodate 2,000 to 5,000 participants, but we anticipate 100 to 200 youth participants, including members of LGBTQAI+ community. We will be present to assist all the participants throughout the event, and this project management strategy will ensure efficient and effective implementation. Here are the different project outline for this project proposal. First, we have the materials needed before and during the seminar. For these, we have first the flyers and posters promoting HIV awareness and sex education. This will be visually appealing and uses clear, concise language. Second, informed consent forms, especially crucial for minors participating in the seminar, ensuring that these forms are legally sound and easily understandable. Third, notepads and pens for participants to take notes during presentations and discussions. Fourth, a projector and screen to display presentations and visual aids. We will test all equipment beforehand to avoid technical glitches. Fifth, a sound system with microphones to ensure all discussions are clearly audible to everyone in attendance. Sixth, tables and chairs arranged comfortably for both participants and facilitators, considering the number of attendees and the layout that promotes interaction. Seventh, HIV test kits, handled with utmost confidentiality and in accordance with all relevant regulations, ensuring proper training for personnel administering the tests. 8. Light snacks and drinks to be served during breaks to keep participants energized and refreshed. 9 are the evaluation forms to collect feedback and suggestions from participants. These forms will be anonymous to encourage honest responses. And last, the participation certificates to acknowledge participants' involvement and encourage future engagement. Second, we have the materials needed after the seminar. We have here a supply of contraceptive options, including condoms and contraceptive pills, to promote safe sexual practices. Distribution will be handled discreetly and with sensitivity. Next are the school supplies for students who attended, encouraging continued learning. We also have cash prizes for the winners of any activities or contests held during the seminar, ensuring transparency in the selection process, and the certificates for winners of activities and competitions. For the second project outline, we have the monitoring and supervision. During the seminar sessions, barangay health professionals and organizers will supervise the events. This includes maintaining the schedule, ensuring orderly conduct, and facilitating engaging, factual, and appropriate conversations for all participants. Regular check-ins and communication among the supervisory team will be essential to address any issues that may arise. This will ensure a smooth and productive seminar.
For the execution flow of the program, at the arrival and registration, the organizing staff will greet the participants, guide them through the registration process, and direct them to their assigned seats to ensure a seamless start. At the opening ceremony, the program will start with a warm welcome with an overview of the session's objectives, importance, and expected outcomes, followed by the introduction of the speakers and facilitators. For the two speakers, the first guest speaker will address and debunk the myths and misconceptions surrounding HIV and AIDS by explaining their true causes, modes of transmission, and effective prevention methods. The second speaker will focus on comprehensive sex education, emphasizing the value of getting tested, talking openly with partners and family, and understanding safe sex, protection, and consent. Now onto the wellness intermission. A short break will be given to allow everyone to stretch, enjoy refreshments, and reflect what they've learned so far. For the real stories and community sharing, to shed light on the real-life impact of stigma, an HIV advocate or survivor will share their story, showing the power of community support. Afterwards, an open forum will give the participants the chance to ask questions and share their own insights. To formally conclude the program, a member of the core team will deliver the closing remarks, expressing gratitude to everyone who contributed to the success of the program. Before leaving, participants will receive printed handouts summarizing the key topics discussed, along with the contact details for nearby health centers and support helplines. To support future improvements, attendees will be invited to complete a short survey to share their feedback, suggestions, and key takeaways from this session.
Good day, everyone. In this part of our presentation, we will walk you through the estimated budget for our project, Breaking the Stigma, HIV Prevention through Sex Education for Rural Community. This budget is designed to support an outreach program accommodating 2,000 to 5,000 participants. We've carefully planned the allocation to make the program efficient and cost-effective, while still ensuring that all important components are covered. Under supplies, we've allotted funds for essential materials such as brochures, informed consents, certificates, and giveaways, including the t-shirts for selected participants. For health supplies, major items like HIV testing kits, contraceptive pills, and condoms are fully supported by the LGU, helping us reduce the cost significantly. For transportation, food, and technical support have also been budgeted to ensure the smooth operation of the event. This includes the lunch for volunteers, snacks for participants, and water provisions. We've also included a modest amount for speaker tokens and social media promotion to help raise awareness and maximize our community reach. Overall, the total projected cost of the program is $75,000, which we believe is a reasonable and sustainable amount to deliver a meaningful and impactful HIV prevention campaign.
Now, let's talk about the real issues here: HIV awareness and sexual health. We understand that it's not always easy to discuss these kinds of topics, but we hope, even for a short while, we can open our minds and approach these topics with compassion and open mind. First, let's talk about stigma around sex and HIV. Many of us grew up in homes where sex was a taboo, seen as shameful, wrong, or off limits. But avoiding these talks, especially with the youth, it can lead to greater risks. If a child doesn't learn what's right, what's wrong, or what is safe, where do they turn? The internet, friends, or even worse, the wrong people. People living with HIV are often judged or avoided. But please do remember that HIV is a health condition. It is not a sin. Next is support from the community. This project is for you, the youth of Barangay Commonwealth. It's not about promoting premarital sex. It's about protection and proper information, spreading education, and support from the barangay leaders, healthcare workers, and even the community is vital. Together, we can promote safety and not shame. Third is the limited budget and need for help. One challenge we face is lack of funds for posters, handouts, and materials. Donations, even small from NGOs or local businesses, are a big help. Even condoms or hygiene kits often come from donations. We aim to create clearer and more inclusive presentations, especially for those who struggle with reading or comprehension. Fourth would be the privacy of participants. Due to fear of judgments, many youths don't question or accept condoms in public. And we totally get it. That's why we use anonymous question boxes, privacy booths, and discrete materials. We distribute it with confidentiality because your privacy matters. Last, and the fifth would be the respect, culture, and inclusion. every word we use is chosen with care. We're not here to offend beliefs or teach immoralities. We're here to promote awareness, self-respect, and safety. Everyone is welcome here. May it be men, women, members of LGBTQA, young or old. Health is for everyone. And we don't condemn anyone. Our only goal is to be safe, informed, and respect yourself and others. Remember, always get tested.